in the states with Republican leaders. According to the Kaiser Family Foundation, as of December 11th, the states colored blue have all expanded Medicaid eligibility for lower-income adults. The majority are Democratic states like California, Minnesota, and New York. Now, in contrast to the orange-colored states like Texas, Florida, and Missouri, who to date are not expanding, who can get Medicaid? Both our guests fear millions of Americans may fall through the cracks and miss out on getting crucial medical coverage. Dylan Roby is a program director of the UCLA Center for Health and Policy Research, and Thomas McCullough is a policy analyst with the nonpartisan profit Missouri Foundation for Health. Dylan, I want to talk to you about this. Obviously, this is a situation here where the battle lines are drawn politically on this, Republican against Democrat. And it seems like if you are a Democrat, you're going to get good health care. Perhaps if you're a Republican in those states, in those red states, you're perhaps not going to get good health care.
Well, I'm not sure about the quality of health care, but certainly the access to care could be diminished. So in the 31 states that are run by Republican governors here in the U.S., about 7 of them have already committed to embracing the Medicaid expansion. Whereas if you look at the 20 states where governors are Democrats, only 2 have said no. So 90% of Democratic states are adopting the Medicaid expansion, but only 25% of Republican states are doing the same.
Well, let's talk about this here. And there's some facts here, and I want you to comment on these facts here. One, you're talking about this Affordable Health Care Act here. It closes the Medicare Part D double hole. Seniors benefit from that. Young people certainly can benefit by being on plans where their parents are. And for the first time, like for instance, in the state of Kentucky, it has the option of federal Medicaid funding for coverage of all low-income populations for the first time. I guess my question is, what's so wrong with that? Why would anybody be opposed to this?
Well, I think what you're describing is the expansiveness of the Affordable Care Act in general. I mean, the law costs $974 billion. It's quite significant in its scope. And one of the really key components, and I would say probably about half of the bill's impact will be felt in access to care and making sure that people can get better insurance coverage. And that's done in one of 2 ways. One is to expand Medicaid programs, which are typically, in our history, starting in 1965, were designed for parents and children as well as elderly individuals who couldn't get health care elsewhere, who are very low income. States partner with the federal government to run that, and our current Medicaid matching rate, so if the federal government kicks in some money to the state governments to help them pay for the Medicaid programs, and the feds contribute about 50 to 70% of that spending. In the Affordable Care Act, it actually expands the matching rate. So in the first 3 years, states that adopt Medicaid expansion for the new eligible population, so it's typically childless adults who don't have kids, and then parents of kids who had slightly higher incomes and never qualified for Medicaid before, would be insured, and their spending would be matched at 100% of what the federal spending level. So it's a far greater investment in low-income safety net populations who have been typically uninsured. And a lot of attention hasn't been placed on that because we've been focused on the expansion of insurance through private insurance through the health insurance exchanges, which have had their own problems.
Right, Dylan, I want to bring in Thomas McCullough here. You know, the major question by a lot of people here, who's going to pay for all this? Now, in the state of Missouri, Blue Cross Blue Shield paid $500 million to set up this program. That's been going on for 11 years. And from what I can see here, through our own research here, they are really looking forward to the Affordable Health Care Act being implemented here because there will be money for this and it will help a whole lot of people out. What's your take on this?
Well, I mean, we're really excited about the opportunities. We have been since the law was passed. In fact, we went out and asked Missourians what they thought about the Affordable Care Act, and they hated it. And then we asked them about the components of the law, and it turns out they liked all of the components. So then we asked them again, so you didn't like the law, but you like what's in the law. Does this change your opinion of the law? And 52% still said they hated it. So we started going out to the state of Missouri in small communities and trying to build support for the law. But what we quickly found was that the politics had kind of gotten ahead of us. And the politics of the Affordable Care Act are such that people who would benefit most from the law are least likely to support it and its implementation.
I mean, to me, that's absolutely crazy. And Dylan, I got to ask you that question. Republicans seem to be very effective in turning people against the things that are really helpful to them.
well, absolutely. I mean, the Republicans have been able to message this thing in such a way. I mean, even when we talk about Obamacare, you create this kind of bias against the law. In fact, here at the Missouri Foundation for Health, we had to actually, as a staff, work hard not to call it the bill. And even recently, you saw a couple legislators, Mitch McConnell being one of them, asking the NFL to not help states and their exchanges, and he again called it the bill. So there's been this messaging, there's been this characterization, such that in some ways, implementing the Affordable Care Act is really an uphill battle.
It seems to be the case, but it's not an uphill battle in certain states. Dylan, in California there, things seem to be going well. People are enrolling. I guess the website is working. Why are things so positive in the state of California?
Well, I think California initially kind of was full steam ahead on the Affordable Care Act's implementation. Even Governor Schwarzenegger, who is a Republican, was very pro-ACA when it was first passed. He had been responsible for a push to reform healthcare along the same lines back in 2007 that ultimately failed. So it was kind of different in that you had this somewhat moderate Republican governor who went forward, said that they would take advantage of the Medicaid expansion prior to the Supreme Court decision, and then, of course, started the push for Covered California, which is our health insurance exchange. And so we've been planning this since 2011. I think one of the issues that's happened at the federal level is that the Senate bill that ended up becoming the Affordable Care Act very much valued states' rights. And it said that each state would be able to create its own health insurance exchange. And I think the planners thought that maybe 5 to 10 states at the end of the day would say, let's just let the federal government operate it on our behalf. And what turned out is that 34 states decided to do that. So the federal government had to take on a much larger scale project than they originally anticipated. And states like California and Washington have been able to set up their own exchanges in a manageable way, work with the plans directly in each state, and set up websites and methods for people to sign up that has avoided all of the political repercussions that are occurring at the federal level.
Thomas, I think politics aside here, once this plan is implemented and people actually see how they can benefit from this, my bet is, even in some of these red states, people will start to sign on and they'll probably have a different view of all of this once they actually see things implemented. What are your thoughts?
That's the position we're taking. We think of it a lot like the Social Security program. I mean, when it was first passed, it wasn't very popular. The American public was skeptical, and then they started getting checks. To me, that's the most tragic part. And California is a perfect example of it working. Missouri is a perfect example of, we were a state that wanted to run our own exchange. We were ahead of the curve. We were one of those early innovator states. And then a disagreement between our legislature and our governor led to us not doing it. So when Social Security finally kicked in and worked, it was popular. We have a feeling that when the exchanges or the marketplaces really begin to work, low income and middle income families, small businesses see the positive effects of it, it's going to be hugely possible.
Absolutely.
But instead of a small speed bump, we now have a hurdle.
Absolutely. You know, this is not going away. We're going to keep our eyes on this. Dylan Roby, Thomas McCulloch, thank you guys so much for joining us and your insight.
Thank you.
Thank you.
Okay. And this is Arise America.